So the chief complaint will be fracture in the right leg. Okay, this diabetes, hypertension, all will be coming into past medical history or okay, past medical history. History of physical illness. What is at the present time, what are the illness to me? All will be recorded in history of physical illness. Next, past medical history. What are the procedures? What are the meditations I'm taking past? All will be mentioned there. Surgical history will be also, if it might, some surgeries may be done before a year or 2 or 3 years. All will be, surgical history will be denoted there. Social history means some of the patients might be addicted to drugs, some other alcohols. So all will be mentioned there in the social history. Next, family history. My father, my mother, my brothers, they might have some other medical conditions. All will be denoted here. Mostly father and mother, grandparents. Okay. Then review of system, it's overall review and what overall problems they diagnosed, and the physical examinations they might done some, they might check the BP, all will be denoted there. Vital signs means what are the vital signs, what are the identifications what we have, or some disabilities we might have, all will be mentioned there. And the assessment, impression, diagnosis, what are the final report, what we have assessed at that day, and what are the conditions or the impression, what are the main thing the doctor find it out, and what are the diagnosis is there, and what are the meditations were given, all will be given in the last. Okay, now there are two types of encounter. I have explained you, right? First one is face-to-face encounter. Here, we need to check the patient name. Okay, in face-to-face encounter, we need to check the patient name in the medical record and verify the year of service. Encounter want to be with the valid credential. Valid credential means for each and every providers, I mean the doctors have some credentials. So for face-to-face encounter, we have some valid and invalid credentials. Okay. So the medical record, the credential should be valid. Then only we can code the medical record. The presence record elements, CC as a chief complaint, HPI, physical examination, assessment, everything need to be clearly mentioned. Okay. Then only this record can be coded by the medical coder. Okay. This is the format of medical record for face-to-face encounter. Face-to-face encounter, actually face-to-face encounter means we are seeing the doctor face to face. We are visiting the doctor in hospital. Simply by visiting or take the consultation from the doctor in the hospital. Okay, these are the examples of physicians for face-to-face encounter. General physician, dermatology, cardiology, patient practice, occupational therapist, neurology, nephrologist, hematology, medical oncology. These are the physicians we can take face-to-face encounter. Okay, for non-face-to-face encounter, we are getting the consultation in telephone, fax, email, nurse encounter, incomplete records. All will be non-face-to-face. And X-ray, ECG, ECG and EKG both the same. Echo, CT scan, all will be non-face-to-face encounter. Okay, these are last basic steps in coding. First, the medical coder kept the medical record. Okay, now we need to review the medical record. First, we need to check the patient name, year, date of birth, provider's name, the credential of the doctor, provider, everything all fine. Okay, first we need to review this. Okay, the basic things were passed. Now we can code this. We are next identify the principal diagnosis and procedure to be coded. What is principal? Principal diagnosis at the consultation day for which issue? For what issue the patient is consulted with the doctor, examined with the doctor. We need to see the principal diagnosis. Okay, now you have to find the principal diagnosis and the procedure. These procedures need to be first checked with the alphabetical index. The main term we need to check with the alphabetical index. Already I explained you the alphabetical index. Okay, now I have taken the first three, the category. First three digits, it's called category, right? I have taken the first three code of from the alphabetical index. Next, I need to see the subterms. For the next four categories, if there are any subterms, I need to search in the tabular index, and I need to take the selected sign to select the correct code from the tabular index for the subterms. Okay. Now I have framed the code now. There may be some four set of codes I have taken. Now you need to assign the code with a high level priority. Okay, this priority will be vary based on the project. Okay. Next, there are two demo videos. I hope this is clear
Let's
to
go to
everyone.
diagnosis major depressive disorder, single episode, moderate. What is our main term? It is disorder. So we go in our alphabetic index to disorder and then down to depressive and single episode. Moderate takes us to F3 2.1. If we were to go under depressive to single episode, we'll say C episode depressive, not quite where we're going. And of course, we never code anything directly from the alphabetic index. We always verify in the tabular list. So let's go to F3 2.1.
Okay. Here, what is the diagnosis in the medical record? Major depressive disorder, single episode, moderate. Okay. Okay. This is where, which is the major or the major diagnosis here? It is the major part. It is a disorder. So in alphabetical index, we need to search in the disorder. In alphabetical order, we need to search for disorder. Under disorder, we need to take depression. Okay. Under depression, we need to take, there may be major, moderate, or minor. We need to search for minor. You might see there, right?
What is our main term? It is disorder. So we go in our alphabetic index.
Okay, here it is a disorder. We need to, I guess it's not clear. Okay, we are searching for disorder in the alphabetical index. Next, we need to, under disorder, we are taking depression. Under depression, we are taking the major. We are taking the first three codes there. Then we need to single episode. Then we need to move to, sorry. Then we need to move to tabular index. Here, major depressive disorder, single episode, moderate is there, right? It is a F321. This is the code for this disorder. Like this, we need to find the code. This is for ICD 10CM. Next for CPT. Okay, in CPT, already I explained you, it is a procedure. So, they will be give all the history. See,
the patient has been experiencing pain from a mass on the right parotid gland, which did not improve with antibiotics. Surgeon performed a right lateral lobe parotidectomy. While managing to preserve the facial nerves, mass was 1.7 by 1.1. Procedure was successful and patient was sent to recovery. Okay, so we're going to start under our E's for excision because we're excising that right lateral lobe of the parotid gland, which means it's a partial. So it's going to give us that code range. Where is it? Where is it? Okay, excision of parotid, what is it? Excision of parotid tumor or parotid gland. And here's lateral lobe with dissection and preservation of facial nerve, 42415. And then, of course, we can't forget to add on our RT modifier. So there we have it, code 42415 with the RT modifier.
Okay, this is an example for CPT coding. With this, I have completed my presentation. I hope everything is clear to you. Now I was confident something. You have learned about the medical coding. What is the basic process and how the coding will be. I guess I hope you have understood everything. Kindly let me know if there are any further queries or anything is there. Based on your career, if you're having any doubts, actually as of now I've taken only the basics. Due to time constraints, I've taken only the basics. If any of you have doubts on how when to enter into the medical coding, how I can learn this, what are the sources for this, what are the scope of medical coding, how the job structure will be. If you have any queries with that, kindly let me know. I will explain you. Thank you, team.